And I've removed all the viscera. So the heart and the lungs are gone, and your stomach and your pancreas and your intestines are all gone. And all I'm seeing, I've gone all the way down to the spinal cord. And so what's this big indentation coming down the front of it? The ventral median fissure. I haven't cut into my spinal cord at all. I can't see the central canal unless I cut into it, unless I do a frontal section, right? So this is the actual top of my spinal cord. So what you're looking at is this. Isn't this the front of my spinal cord?
Yes.
Okay, so doesn't this look like this?
Mm-hmm.
Okay, so this is my ventral median fissure. This is my ventral median fissure. Okay, all right. So my spinal cord extends all the way down to the level of about L1 to L2. So this is L1, that's L2, and so that's where it ends. And the end of the spinal cord has a cone shaped. And so this is called the conus medullaris. Okay, right? So if it ends at the level of L1 to L2, then it still has all these spinal nerves coming out of it that have to go through lower interventricular foramina. Did you see them all coming out through the intervertebral foramina? Okay. Did I say interventricular a minute ago?
Yeah.
Intervertebral foramina. Okay. As they wait to exit out of their appropriate intervertebral foramina, then it forms something that looks like a horse's tail. And so this is what we call the cauda equina, because cauda means tail and equina means horse. At the very center of the cauda equina is a connective tissue strand that goes all the way down to the coccyx. And this is the filum terminale. Everything you see in the cauda equina is neurons, axons of neurons. Okay? But this filum terminale is just a connective tissue strand, like a ligament. And its function is to hold the spinal cord in place, to anchor it to the coccyx. Okay, that's its function. Okay. Did you have a question, Steve? It look like clumps of dental floss.
Denticulate ligaments.
Those are the denticulate ligaments. Okay, and they anchor the spinal cord laterally. Okay, so my filum terminale stabilizes my spinal cord vertically, and my denticulate ligaments, which really are on both sides, but this model only shows them on one side, they anchor my spinal cord laterally. Okay? I could also ask you the different plexuses. So as spinal nerves exit their intervertebral foramina, they interweave and braid with each other in every area except the thoracic region. So this is my cervical plexus, and this is my brachial plexus, and this is my lumbar plexus, and down here is my sacral plexus. Okay, all right. In the thoracic region, I don't have a plexus, and that's because the thoracic nerves that come out are just simply the intercostal nerves, and what do they innervate? It's not rocket science. What do the intercostal nerves innervate? The intercostal muscles, right? But you have to tell me internal intercostal muscles, or you could tell me external intercostal muscles, or you could tell me any of the abdominal muscles, because they innervate rectus abdominis, the external abdominal oblique, the internal abdominal oblique, and transversus abdominis. Okay, they also innervate, because aren't they in this area?
Yes.
Okay, right. So those intercostal nerves also innervate those abdominal muscles. Okay, you have to know one nerve that comes off of the cervical plexus. So this is my cervical plexus, and here's the one nerve right here. So this happens to be the right phrenic nerve. You also have a left phrenic nerve. So this is the right phrenic nerve coming off of the cervical plexus. And what does it innervate? It innervates the diaphragm. Okay, so this is how you can remember that. C3, C4, C5 keeps the diaphragm alive. Okay, right? So it's the only nerve that you have to know that comes off of the cervical plexus. So C3, C4, and C5 are coming off of that cervical plexus. And that nerve is going to go all the way down to the diaphragm and innervate it so that you can do what? What is your diaphragm going to do for you? So that you can inhale. That's right. Okay. All right. So that's your phrenic nerve. you have to know 5 nerves that come off of your brachial plexus. Okay, so let's go to that awful chart. You can see your brachial plexus, right? Okay, and on this chart, you can see a bunch of dotted lines. See all the dotted lines? That means that nerve is behind the bone. Okay, all right. Well, there are 2 nerves that come off of this brachial plexus that go behind the bone. And so, see this dotted line right here? This is your axillary nerve curling around from the back side of the neck of the humerus. So that's your axillary nerve. And it innervates, what muscle is right here? The deltoid muscle. And also teres minor is there. Remember, teres minor comes from the scapula around the outside to insert on the greater tubercle of the humerus. So this axillary nerve innervates deltoid and teres minor. That's a really important nerve to remember because they'll teach you clinically in your nursing classes to never give a shot on top of the axillary nerve or around the back side of the humerus. I'm looking for it. There it is. See the dotted line right there? Okay, so this nerve is coming, it starts here, goes behind the humerus, and then reemerges on the lateral side of the humerus. This is the radial nerve. Okay? The radial nerve. And what muscle is back here? Triceps brachii. And what muscle comes down the lateral side of your humerus and your forearm? Brachioradialis. And so that's what the radial nerve innervates, right? It also innervates extensor carpi, most lateral. Do you see how this is the most lateral one? As it comes down, it gives off branches to the front of the humerus. Well, what sits on the front of the humerus? What muscle sits on the front of biceps brachii and brachialis? Okay, so let me just show you scapulocutaneous. See the branches going to brachialis and biceps brachii? It's the most lateral muscle that comes off of the front side of the brachial plexus. Okay, right. What nerve is this? Musculocutaneous. Sometimes I ask it here because you have to know what it innervates, right? It comes straight down the middle of the humerus, and the middle of the forearm is the median nerve. Not medial, but median nerve, okay? And it innervates palmaris longus. Remember, if you clench your fist, you can see the tendon of palmaris longus. So it also innervates pronator teres. It innervates all these branches going to your thumb. Okay, so it innervates what are called the thenar side of that anterior part, and there's a small place where it goes behind the medial epicondyle of the humerus. See the dotted line right there? And the ulnar nerve continues down the little finger side to your hand. And the ulnar nerve innervates flexor carpi ulnaris, and most of the small intrinsic muscles of the heart. Here's my cervical plexus, right? Isn't this my cervical plexus?
Yes.
So here I come down my cervical plexus. I see this nerve. It's the only one you have to know. And it ends in a dome shape. Isn't the diaphragm dome shape? Mm-hmm. So this is my right phrenic nerve. I can't see this one coming off my cervical plexus as well because his head and neck is turned, but this is my left phrenic nerve right there. Okay. All right, later on, not this lab exam, but the next one, you're going to have to know that this is cranial nerve 10. This is cranial nerve 10. This is the right vagus nerve. This is the left vagus nerve. So you are going to have to know those cranial. Back side of the humerus is the axillary nerve. This is the left axillary nerve. Tell me what it innervates. Deltoid and teres minor. You only have to tell me one. Okay? Right? And then here's this nerve coming around the back side of the humerus. This is the radial nerve. Tell me something that innervates. Triceps brachii, brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis, any of those. Okay, right? I can get a tiny feel for this ulnar nerve coming behind the medial epicondyle of the humerus, right? But it comes off one of the anterior branches of my brachial plexus. So the only reason I knew that that was ulnar from this posterior view is because it went behind the medial epicondyle of that humerus. So tell me something that the ulnar nerve innervates. Flexor carpi ulnaris, and all the small intrinsic muscles of your hand that move your fingers. Okay, all right. What would you call this? Cervical plexus. Why can't I see the phrenic nerve on it? Because it's anterior. Okay, more anterior than posterior. What would you call this? brachial plexus. I really can't get a good feel for my lumbar plexus. It's right in here, but you don't really see the brachium that well. But you really can see the sacral plexus. Okay. All right. So in the next lab exam, you're going to have to learn the nerves that come off of the lumbar plexus and the nerves that come off the blue tape on cervical plexus. And so I'm going to pick it up. Okay, that tape. I think I cut my fingernails last night, so can't get a grip. Okay, all right. I cut it enough so that I can see this one nerve coming off of it that you have to know. That's the phrenic nerve. What does it innervate? The diaphragm. What would you call this? The brachial plexus. So now I can ask you all of the nerves that come off of the brachial plexus on this model. Okay, so I can see that there are 3 anterior muscles. The most lateral of the anterior muscles is the musculocutaneous. The one that comes straight down the midline is the median nerve, and then this one is the ulnar nerve, which goes behind just a short while the medial epicondyle of the humerus. Okay, tell me an innervation of the ulnar nerve. Flexor carpi ulnaris. Okay, tell me an innervation of your median nerve. Palmaris longus, pronator teres, flexor carpi radialis. Tell me an innervation of your musculocutaneous nerve. Biceps brachii and brachialis. Okay. All right. I can also see 2 nerves coming off of my brachial plexus that come from behind the humerus. Here's the first one. Axillary nerve. Tell me what it innervates.
Deltoid.
The deltoid and teres minor. Okay. And then I can see this one. It goes behind my humerus. I see it here, and I pick it up here. That's my radial nerve. Tell me something that innervates. Triceps brachii and brachioradialis and extensor carpi radialis longus and extensor carpi radialis brevis, right? Okay. Tell me something that these nerves innervate besides the internal and external intercostal muscles. Transversus abdominis, external oblique, internal oblique, rectus abdominis. Okay. What would you call this? Lumbar. This is the lumbar plexus. What would you call this? Sacral plexus. Here and here are the sacral plexus. But I could ask you other things. I think I did, didn't I? Didn't I ask you what this was? So this is the left lateral sulcus. What lobe is this? The left temporal lobe. What would you call that? Cerebellum. What nerve innervates these guys for pain? Trigeminal, cranial nerve 5. Oh, look, I even see some cranial nerves on this one, right? Good grief, okay? But I can see this one coming off above the pons. This is going to be, yep, that's trigeminal coming off the lateral side of the pons. Down at the base of the pons is 6 abducens. I slide over, and the first one I come to is 7 facial, and on the other side of it is 8 vestibular cochlear. And the rest of these aren't definitive enough for me to ask them. Okay. What would you call this? Oh, yeah, that's good enough. Well, I won't ask that. What's this? This is the frontal lobe, parietal lobe, and I know down here somewhere is my occipital lobe. Okay, so that's